Namaste. Now let us understand about sperm factor in men. Around 30 to 40% of the males have problems related to sperms. That means out of 10 persons, 3 to 4 persons can have some disorder in their sperms. First, let us see how the sperm fertilizes the female egg, or how does it function. Normally, on the 15th or 16th day of the period, the egg ruptures and follicle comes out. This female seed is very small, that is 1/4 size of a dot. This egg comes in the fallopian tube. At that time, during intercourse, the sperms enter the fallopian tube. Now the sperm has to enter into the egg, and in order to do this, it has to overcome two barriers. The first layer is called cumulus and the second layer is called zona. Cumulus consists of 2 to 3 layers of cells which are joined with each other with a glue-like substance called hyaluronidase. The sperms have a cap on their head which is called acrosome. A chemical called hyaluronidase oozes out of it. What does this chemical do? It dissolves the glue-like substance in between the layers and the cells get separated from each other. Every sperm emits a small amount of chemical. That is why a large number of sperms are required for clearing the first layer. That is why it is important to have a good sperm count. After cumulus, the sperm reaches the layer called zona, and the sperm has to penetrate through it to enter into the egg. It needs a lot of strength to do so. The sperm obtains the required strength from its tail. After penetrating through this layer, the sperm enters the female seed and fertilizes it to form an embryo. This strength of the sperm, that is the motility of the sperm, is observed through the microscope. Therefore, the speed is necessary for the sperm. Now these two factors of the sperm, that is count and motility, can be observed under a microscope. In some men, the sperm count is good, but speed or motility is not sufficient, while in other cases, problems exist in both the count and speed. Now we will see the factors causing the problems in sperms. So there are 3 types. First is the deficiency of nutrition or vitamins. Some people do not have a proper diet. They should consume milk, fruits, eggs, which are necessary for the health. Along with this, regular exercise is also required to increase our immunity. Nowadays, a lot of people smoke, chew tobacco, pan, gutka or other harmful substances and also consume alcohol. Now all these substances contain harmful toxic chemicals. These toxins attack the sperms and decrease its production, ultimately causing many disorders in sperms. The third factor is infection, which can be caused by unhealthy eating habits, drinking, or through unsafe physical relations. Hence, it is necessary to stay away from such habits. Defects in sperms are of 2 to 3 types. First is head defects. In this type, sperms have an abnormal head, so it can be small and thin or abnormally enlarged. The second type is neck defects. It means the neck of the sperm structure is weak. The third is the tail defects. Due to the defects in the tail, the sperm cannot generate the necessary force or energy, and this reduces the sperm's speed or motility. There is another important factor called anti-sperm antibodies, due to which the count and speed of the sperm can be reduced. So what do we mean by anti-sperm antibodies? In our childhood, when immunity is being developed, sperms are not there in the body. Therefore, our immune system does not recognize sperms as part of our body. Now when the child attains puberty at the age of 10 to 12 years, the sperms start developing. At that time, if the child gets a testicular infection or a wound, then the sperms enter into the body or the bloodstream. At that time, Since the immune system doesn't recognize the sperm as a part of the same body, it creates antibodies to work against the sperms. And these antibodies go and destroy the sperms. Some antibodies even attack the sperm producing glands and decrease the number of cells which produce sperms, which ultimately affects the sperm count. Some antibodies attack on the head, neck, or tail of the sperms, which are called anti-head antibodies or anti-tail antibodies. This reduces the speed or the motility of the sperms. Due to this, due to the reduction in the sperm's count or motility or both, the sperms are unable to fertilize the egg. Now let us see what to do in such a case. For such patients, ICSI treatment is advised. In this treatment, what happens is that female eggs are collected in the lab and the sperm samples are taken separately and the fertilization is done in the lab. As seen earlier, there are two obstacles for fertilization. The first is cumulus has to be removed. This is called denudation, which is done manually. And after that, the sperm is injected into the female egg. This is done with the help of the microscope. So it's a sort of microscopic surgery. In this, one sperm is injected into one female egg, so it fertilizes the egg and forms an embryo. After 2 to 3 days, this embryo is transferred into the uterus and impregnation takes place. Normally, once the ICSI treatment is given, 3 to 4 out of 10 women conceive pregnancy. In this way, after observing the speed and count of the sperms, the nature of the problem is understood and the line of treatment is decided. In some cases, it is possible to treat the patient only through medicines. It takes 85 days for the sperms to be generated. Therefore, we have to wait for 2 to 3 months after medication has started to see the effect or the result of the treatment. If there is no improvement, then we can go for test tube baby or ICSI treatment.
अपॉइंटमेंटसाठी कॉल करा 99 22 432 972 किंवा भेट द्या www.ivfcare.in. आजच संपर्क साधा.